Nurses wearing garbage bags, mask shortages, overflowing hospitals. These are the images you see coming from hospitals in America.
Reusing PPEs are not acceptable. It's just not. That's not based on science. That's based on supply.
But why are hospitals in one of the wealthiest countries in the world struggling in this pandemic? To understand why so many U.S. hospitals have been caught short, we should start with the question, who runs America's hospital system?
The challenge of the U.S. healthcare system is that it's not one healthcare system. It's 50 different healthcare systems, one in each state. And within that, you essentially have hundreds or thousands of healthcare systems.
Around 1 in every 5 U.S. hospitals is government funded and run. More than half of U.S. hospitals are run by private corporations or nonprofits. Now, don't be fooled by the name. Nonprofit hospitals are indeed profitable. It just means they do enough charity to be tax exempt. The U.S. spends $3 trillion a year in healthcare goods and services. And if it were a country, U.S. healthcare would be the 5th largest economy in the world. Many private hospitals in the U.S. are run like businesses. And like any other business, hospitals are concerned about revenues and their bottom line. Proponents of healthcare reform have been calling out this model well before the pandemic.
The function of healthcare must not be, as is the case right now, for the drug companies and the insurance companies to make huge profits.
That system has consequences which affects patients, particularly the most vulnerable. The first thing that U.S. hospitals don't have enough of are beds. There are only 920,000 hospital beds in the U.S., and 65% of those beds are occupied at any given time. In the US, there are 2.8 hospital beds per 1,000 people. That's fewer than other countries hit hard by COVID-19.
We found that across the country, in almost every state, in almost every hospital market, that unless hospitals were able to create or free up existing hospital capacity, they would be on average 2 to 3 times more patients than available beds.
So why does the US, a country of over 300 million people, only have 920,000 hospital beds? Well, despite all that money flowing around, there are laws that limit how much hospitals can spend on things like more beds. They're called Certificate of Need laws, or CON laws. They aim to reduce healthcare spending and make hospitals cheaper to run. If profit is the imperative, then maintaining emergency bed space that goes unused most of the time doesn't make sense, unless a crisis hits.
The dominant storyline in health policy was the overuse of healthcare. We're doing too much healthcare because we had too many hospital beds, too many providers providing care that was creating demand and driving up overall healthcare spending.
It also means that before a hospital can purchase more ICU beds, for example, it needs to be approved by a state regulatory agency. The policy's intention of keeping hospital prices down may have backfired. Take New York, for example, the state with the most COVID-19 cases. Without CON laws, New York would have had 317 hospitals compared to 220 today. But lack of beds for patients isn't the only problem facing America's hospitals during this pandemic. By now, you probably know there's a major shortage of personal protection equipment, or PPE.
We've had this issue since the pandemic arrives that we were going to have to reuse our PPE, particularly the N95 masks. This has happened to me more than once when I go to work and I have a patient, a COVID patient that's in the room that I need to go and see, and I don't have a mask.
What Mewata is experiencing is a result of how the system is set up.
A lot of our healthcare systems run on an inventory system where things are delivered just in time. It's very efficient for running a hospital, not having to have a large stockpile of extra equipment. But that efficiency, I think, has hurt us. It works when you don't have a pandemic.
At a national level, the US has 12 million N95 masks and 30 million surgical masks in its emergency stockpile. That's only 1% of what medical professionals would need during a full-blown pandemic. Cost-cutting has come to characterize US healthcare policy. The American Hospital Association estimated federal cuts to hospitals will total over $200 billion by 2028. In 2016, the Trump administration slashed funding for pandemic preparation. This is despite a 2015 report that warned of a significant shortage of things like PPE, antiviral drugs, and ventilators in the event of a pandemic. These decisions trickle down to medical workers on the front lines.
We are nurses. We are there for our patients. We are there for our community, and we need the institutions that we work for to be there for us.
Half of the registered nurse workforce is 50 plus. More than 1 million nurses are expected to retire in the next decade, and shortage of over 55,000 primary care physicians is projected by 2032. To empty medical beds for COVID-19 treatment, hospitals have canceled non-urgent elective procedures. As a result, 42,000 healthcare workers have lost their jobs in March, just as COVID-19 was spreading across the US.
I just feel like this pandemic is an eye-opener for everybody, or at least it should be. We are in dire times. We need nurses. We need to preserve our staff. And when nurses are in a position where they don't feel safe, they're going to speak out.
As the pandemic worsens, states are having to compete for medical equipment, not just by outbidding each other, but also outbidding the federal government.
I think these are the three important lessons that we need to take from this. Is we need a much more robust testing and surveillance strategy that's coordinated across hospitals, states, and the federal government. We need the ability to dial up and dial down capacity and be able to pool that capacity. And the third part is we need the ability to produce and stockpile and distribute masks and respirators for the future.
But as frontline workers in hospitals continue to get overwhelmed, perhaps the question is this: if the US keeps a for-profit medicine model, is the country going to be in the same situation when the next pandemic hits?